As Greg Stevenson just reminded me, I was trying not to come here today. We had all kinds of problems in making sure I got out here. I'm really glad I did, especially once I got the talk put together. It would have been a shame not to give it to somebody. You know, if you don't already have a copy of the handout, why don't you grab one, raise your hand. Everybody got one? Okay, a couple more to go yet. I've tried to put together there a structure for this whole thing with a few of the more recent or some of the more explanatory references so that you can expand from there, add notes, subtract things that are errors, etc., as you find that new information cancels out the old information. Hopefully I've got things in pretty good shape there. When they asked me to talk about the gross and microscopic lesions of swine reproductive diseases, I said, well, that shouldn't take very long. There aren't any. And for a large part, that's true, but I think we need to kind of go through and sort those things out. About 60 or 70% of the abortions that we see in our laboratory in swine have no diagnosis made on them. We don't know exactly what's causing them. The other 10 or 20, maybe if we get really lucky, up to maybe 25% that we do make diagnoses on have very few lesions. And we'll jump into that and see what we can tell and go through some things that are significant in taking a look at those diseases of swine then. If you want to turn on the projector. Just quickly review some of the terminology. I like this 2 or 3 classifications of stillbirths. The third one's not really a classification. Those are the ones that they thought were, whoever made up the classification system said there's type 1 that die before parturition, type 2 stillbirths that died during parturition, and then type 3 that weren't really stillbirths. They just died so quickly after being born that the owner just thought they were stillborn. But the only differentiation here, primarily those type 2 stillbirths will usually have meconium in their lungs or in their tracheas. They'll try to inhale during that birth process, and the fetus that went just before it probably dumped meconium through the tract, or the pig itself will dump meconium when it gets anoxic right into the amniotic sac, and then will inhale it. If there are inflammatory cells, and there are a few immature inflammatory cells in this particular lung, it strongly suggests that that fetus became anoxic before parturition. So a couple of little features there that you want to make sure of when you're looking at those lungs. If there's meconium, then look further, look for inflammatory cells, and make some determination whether it's a type 1 or a type 2 stillbirth. So if there's inflammatory cells, it's probably a type 1. That was a placentitis or a fetal infection prior to abortion. What difference does it make? Type 2 stillbirths, those that die during parturition, are usually non-infectious. It's usually delayed parturition, processes where that sow just really isn't getting those fetuses out fast enough, and there's been placental separation and partial expulsion of the fetus before it gets out where it can breathe air. Various other terms. Mummified fetus is always kind of an interesting term to me because depending who you read, once that fetus dies in utero, for some people it becomes a mummified fetus. For others, first you have a stage called in utero autolysis, in which you have moist degeneration of that fetus. It's sitting in there in a sterile environment for 24, 48 hours, basically all of the red blood cells break down. You develop subcutaneous edema. That reddish fluid imbibes into the subcutaneous tissues, and you have that cooked look or parboiled look that you see in so many fetuses. Then as the drying and shriveling process begins, I guess I like to think of those as mummification. Mummies to me are dried. And so mummification probably begins within 2 or 3 days after death of the fetus in utero. Abortions then, those terms, premature expulsion of a dead fetus. If it's a dead fetus at term, it's technically a stillbirth. In pigs, normal gestation is right around 114 days. So anything before about 112 days is considered a premature birth. If it's alive, if it's dead, it's an abortion. Embryonic death, you'll hear that term used throughout the literature, and there we're talking the embryo stage ends when calcification or mineralization begins, and in swine that's around 35 days. So here we've got fetuses in different stages of decomposition. The one on the right, everyone would agree is a mummy. The other ones are beginning the drying and shriveling process. You can see they're shrunken down, and so those would be, by most people, designated as mummies also. Before that time, you could just call them stillbirths if they're at term, or aborted fetuses if they're prior to term. A few really significant times in the fetal life of swine. The first is implantation, about 14 days, mineralization, about 35 days, and then swine fetuses develop immune competency somewhere around 70 days. So those 3 times are fairly important in the fetal life. Swine generally require about 4 embryos, and that's a general rule. Some will maintain it on 1 or 2. Some of them, if they lose all but 3 or 4, will terminate the pregnancy. But generally, a couple of fetuses in each horn is enough to maintain a pregnancy in swine. If they lose the fetuses prior to uterine implantation, the owners may not even recognize that they were pregnant because they will return to estrus. A little bit of a delay there. If there's death after implantation but prior to calcification or mineralization, so in that 14 to 35 day range, you're going to see primarily absorption. You won't see any abortions, you won't get any fetuses. Death after mineralization, if a couple of those fetuses remain at that point, if at least 2 of them remain at that point, they'll usually carry that pregnancy on to term, and all of those dead fetuses will mummify, and depending on the stage of that death, will be delivered at term, and you'll find fetuses of varying sizes depending on what caused that particular reproductive loss. If later on in pregnancy the entire litter dies, depending on what initiates that process, there's a very good possibility that you can have all of those fetuses mummified. The sow doesn't recycle. She looks like she's pregnant. She goes to term. She may even go past term, and the owners are saying, well, I thought she was pregnant. She bellied down. She looked like she was going to deliver, and nothing happened. In fact, she went later than the rest of the sows. She should have delivered by now, and she hasn't returned to heat. But she really doesn't look like she's pregnant anymore. And this is probably what's going on, that entire litter has died, and she's carrying some mummies in there that she's trying then to get rid of. In swine, maternal interruption of the pregnancy is the usual cause of abortion. the maternal interruption of that pregnancy. And that often occurs as a result of toxemia or endometrial damage. And I'll talk a little bit about that mechanism in just a moment. But prostaglandin release is involved in that with luteolysis. Excuse me. And by toxemia, we're talking about bacterial endotoxemias, generalized diseases in that dam, and you have a number of infectious diseases in swine that may produce abortion without ever directly affecting the fetus. So she may get sick due to influenza virus. And you may not be able to find lesions in the fetuses. You may not be able to find much, if any, virus in the fetus. She may come down with TGE and develop enough toxemia, and through this process of prostaglandin release and luteolysis may indeed abort that litter. Placentitis and endometrial damage in abortion is another mechanism, and then, as I said before, a very high percentage of those are non-infectious causes of abortion. Again, this mechanisms of abortions caused by infectious organisms. One of the mechanisms is that indirect mechanism, systemic disease, toxemias, endotoxemias, releasing prostaglandins that result in abortion. We have some of the diseases that produce direct fetal infection. It infects the fetus and kills the fetuses and results in abortion or fetal loss. Placentitis in swine is a relatively uncommon cause of abortion because if they've got 10 fetuses in there, they have 10 placentas in there, and you may have a placentitis of 2 or 3 or 4 of those placentae, but the remaining fetuses are still intact and still maintain the pregnancy. So placentitis is somewhat uncommon as the cause of the abortion. You may find placentitis when you're examining those fetuses, but unless it involves nearly all of the fetuses in the litter, you may not end up with an abortive situation. So some specific infections then that will cause fetal loss in swine. Porcine parvovirus, a fairly common cause of reproductive loss, much more common before vaccines hit the market about 10 years ago, but we still run into situations where porcine parvovirus is causing some reproductive loss. It's a DNA virus, it's persistent, and it's usually an inapparent infection in the adult animals, and even in young animals. Porcine parvovirus in swine causes very little in this country for lesions or disease other than the reproductive loss. Usually spread by oral exposure. The pathogenesis of that particular virus, like parvovirus and many other species, it replicates in those rapidly dividing cells. And in this case, those rapidly dividing cells are found mainly in the fetus, in the brain, and in other organs, lymphatic tissues. The usual finding in porcine parvovirus is the delivery of mummified fetuses at term along with normal or stillborn fetuses. So we would find at term either live births. This pig looks like he was carried pretty close to term, but was stillborn. There were live births in this litter, and then a series of mummified fetuses of varying stages. With porcine parvovirus, you find that virus will spread in utero from fetus to fetus and will slowly work its way down a uterine horn, and you will then get, as a result, fetuses that are dying at different stages of pregnancy. Once those fetuses reach about 70 days and develop immune competency, they resist the parvovirus infection. Parvovirus rarely kills any fetuses after about 70 days. You may find some evidence of viral infection in a few of these stillborn fetuses, but that's extremely rare. You will find, because of the parvovirus being a very persistent virus, it doesn't decay easily. You can find virus in these mummified fetuses using fluorescent antibody techniques, virus isolation techniques, and that approach to parvovirus diagnosis. Does this focus work from here? Doesn't seem to. Okay. That one might be sharpened up a little bit. The lesions that are found in porcine parvovirus infection depends on who you talk to. When you're presented with a number of mummified fetuses in a diagnostic situation, you're probably not going to be terribly eager to do histopath on them. So in fact, a lot of these fetuses never get examined histologically. There was a study that was done where they did look at these very, very carefully and found that you can find some lesions of mononuclear or non-suppurative meningoencephalitis in some of these little mummified brains. They must have had a lot of fun with that study, but there have been some lesions described for porcine parvovirus. But in a practical situation, most of these tissues are not in good enough shape to discern those lesions easily, and I wouldn't expect that you're going to find, this is a fairly fresh-looking brain, not like those you would find in porcine parvovirus, but there is a mononuclear meningoencephalitis there, a little bit of mononuclear reaction around vessels within the brain. So those are the types of lesions you would expect with porcine parvovirus and that have been shown. PRRS virus, I believe, Dr. Stevenson, you talked about that yesterday or the day before, or Dr. Van Alstyne. Dr. Van Alstyne talked about that. PRRS virus has gone under a number of different names. We call it PRRS in this country, porcine respiratory and reproductive syndrome virus. You'll see it in the literature as PAIRS, as mystery swine disease, as SIRS, swine infertility and reproductive syndrome, or respiratory syndrome. It's actually, the family is Arterioviridae, along with viruses such as simian hemorrhagic fever virus, lactic dehydrogenase elevating virus in mice. And outbreaks occurred about the same year in Europe and the USA, not the USB there. I don't know where the USB is. I'm not sure where that one is. It's on my typewriter somewhere, apparently. But a very interesting story on that particular virus is the way that agent showed up in different parts of the world, spread rapidly among the swine population, and yet some of the viruses involved in this, the Lillestead virus in Europe, some of the US isolates are somewhat genetically diverse, which raises all kinds of possibilities of how, over a period of a year or two, somewhat genetically diverse isolates of this agent showed up all around the world, and we could have some lively discussions about those possibilities, I'm sure. One of the key features of PRRS virus infection in swine is that the viremia is persistent. And when that viremia is persistent, it allows very well the possibility for transplacental passage. It does occur when this disease is introduced into herds. The first syndrome that is generally seen seems to be reproductive losses. Once it becomes more endemic in that herd, the losses seem to shift more into the nursery and the neonatal pigs with respiratory losses. After it's been in the herd through one reproductive cycle, the primary syndrome that will be seen then is a respiratory disease situation. There are several different strains of the virus known, and they do vary considerably in their pathogenicity. So there may be anything from relatively inapparent infections in herds all the way up to very devastating losses in both young animals as well as reproductive losses, and even some syndromes in adult animals or feeder pigs. Because of the fever and systemic effects in the dam, there may be with PRRS virus, and there, in fact, experimentally it's been shown to be some indirect early gestational losses. So the virus doesn't necessarily even have to get into the fetus just because of the toxemia in the dam. She may fail to implant these fetuses or may lose an early pregnancy due to toxemia. The usual presentation, however, though, is weak newborns and neonatal respiratory losses, late-term abortions, and no significant placentitis. So we might see in late term something like this, where we've got some evidence that a few of these fetuses have been dead for a little while. Most of them are getting fairly close to term, and she aborted the whole litter. Usually there are no lesions in the fetuses with PRRS infection, and the infection occurs on the maternal side of the placenta. Here's an example of some mild inflammatory changes in the endometrium of the sow. That endometrium there may produce enough changes to terminate the pregnancy. Some of the folks at Iowa State, in particular Dr. Lauger working at the National Animal Disease Center and Dr. Halber working in our laboratory, have been very, very desperate to find some sort of lesion, some telltale signs in the fetuses. And one thing that they have noted, and we're not sure yet the significance of this lesion, the normal pig this one was taken by cesarean in late pregnancy with a normal placenta and, with a normal umbilical cord. This is the umbilical cord of a PRRS-infected animal with a hemorrhage, the edema in that umbilical cord. Now the question truly becomes, is this a specific lesion of PRRS, or have we sort of been ignoring these umbilical cord changes that are found in nearly all sick and dying fetuses of swine? Could this be occurring with a number of different infectious causes of porcine abortion? And we don't have the answer for that. But this lesion is fairly consistent in PRRS-infected fetuses. Along with that, generally there's some degenerative and hemorrhagic changes in the placenta. And you can see then a variety of changes. Here's a very hemorrhagic umbilical cord. Probably if that had been occurring over all these years, I would have noticed it, but I would not guarantee that. I may have passed it off for years as just a normal occurrence in the way that placenta from an aborted fetus are supposed to look. A little milder change here, just a little bit of a segmental area of hyperemia. This one's doesn't look too bad to me, kind of purple. Here are 2 or 3 more from PRRS-infected fetuses with a hemorrhagic edematous change. And this lines up 4 or 5 of them where you can see the nice lesion that's found in those particular umbilical cords. So fetal lesions are generally absent, with the exception that the umbilical cord lesion has been noted. They have attempted to demonstrate the presence of PRRS virus in those umbilical cord lesions and have been what I would call mildly successful. There is not a lot of viral antigen there. It's not in that vascular wall where you would like it to be, although occasional myocytes will label with immunochemistry methods. The vasculitis in those umbilical cords seems to be in the artery, not in the vein, and consists primarily of hemorrhage and mild inflammatory and degenerative changes. The multifocal, the lymphocytic vasculitis, paravascular endometritis, you saw a picture of that. In the young pig, and pigs infected in utero may be born with a lymphadenitis already present. But the young pig, one of the hallmarks, which Dr. Van Alstyne, you showed him some lymph node lesions yesterday?
Rousseau's work.
Okay. And that's what's being quoted here. Kurt Rousseau up at Minneapolis or Minnesota has demonstrated a rather consistent lymphadenopathy and lymphadenitis in these neonatal pigs infected with PRRS virus. And we've seen that in the work we've done at Iowa State and other locations demonstrating the same thing. The lesions that Dr. Van Alstyne talked about, interstitial pneumonia, myocarditis, occasional encephalitis, we have not found in the fetuses. We've looked and looked and looked throughout all of the time where we didn't know what was causing the so-called mystery swine disease. We looked at numerous brains, livers, lungs, all kinds of tissues from those fetuses that were being aborted, and we're not finding any consistent lesions at all to tell us what was causing that abortion. So for the most part, no lesions in the fetus other than that umbilical cord lesion.
Can you isolate the virus from any stage of those mummified fetuses?
No. The virus is fairly friable. Once autolysis begins in that fetus, the virus disappears. Dr. Stevenson looked at a lot of those in various tissues, and what you could get survival of the virus in tissues, what, 6-12 hours, something like that, Greg? Once autolysis begins, or did Bill do that?
By 24 hours, there was, in tissues, most of the virus was
non-viable.
Yeah, that's in neonatal infected pigs, right?
These were in young pigs.
Yeah. Dr. Stevenson?
Yeah, I just thought you might want to comment on, you talked about the lack of lesions in fetuses, and now we know you can't isolate the virus from fetuses, but is there a common presentation of fetal sizes and stage of gestation when sows abort relative to what you presented for parvovirus, for example?
The general presentation on PRRS would be late term. Would be late term reproductive loss or neonatal deaths, weak pigs, and then on into respiratory syndromes into the young pigs. Where parvovirus presentations, you're going to get fetuses younger than 70 days that are being delivered at term. So you're going to have smaller fetuses along with maybe an occasional dead term fetus. But most of the time with parvovirus, those term fetuses that are dead at that time are due to problems with delivery, slow deliveries, maybe some oversized fetuses, that sort of thing. But the primary thing with parvo is going to be younger than 70 days. With PRRS virus, you're going to see those fetuses. That was about as young a fetus as I usually would see with PRRS that I showed right there with that whole group of them. Most of them are going to be real close to term. Is that what you're seeing here too, Greg?
Yeah, I think the description, and I think it holds fairly true, they generally talk about within the last 10 days of gestation is when they normally, if you're looking at most of it, is when they're going to abort, or they'll often have also a distribution some live-born, rather normal-looking fetuses, along with smaller, non-viable or live-born but very weak pigs.
Yeah.
That's kind of a classic presentation.
Probably the two most common infectious causes of reproductive loss right now in the Midwest in the United States are these two agents, parvovirus and PRRS virus. Now there's a whole lot of reproductive losses that go undiagnosed. So I would, undiagnosed causes are probably number one, and then PRRS and parvo, at least in our area, amount to the rest of them.
So how do you make the definitive diagnosis of PRRS on a fetus then? I mean, is it going back to the herd and doing some...
That's exactly right.
Okay.
Go back to the herd. Our recommendation is, there's a couple of possibilities. Our recommendation is we'd like to see some affected neonatal pigs. That's probably the easiest for us. I think here at Purdue they're doing an excellent job on virus isolation. And are you still trying to get sera from sows and isolate virus, or are you going to the young pig too?
No, young pigs.
Yeah, okay.
We just ask for weak, small pigs that were born viable in affected litters.
Right. There's the possibility to isolate virus from serum from the sows since they're persistently viremic. But I think for most labs, the easiest way is to get those young pigs.
John, our experience has been in the sow, by the time she actually delivers, most of the time, they're not viremic.
By that time?
Yeah, the sows have a much
Okay.
more limited period of viremia, so we're regularly going back to the farm to the affected young pigs.
Okay, good. Serologic diagnosis can be attempted, but the virus is spread very rapidly around the Midwest, and it's somewhat difficult to find herds that don't have antibody titers to PRRS virus. So serology may suggest the virus is present in the herd, but going back to the young pig and looking for lesions and virus in those young animals, the interstitial pneumonia, the lymphadenopathy, finding virus would be the easiest way. We've got a couple of people that are really involved in Dr. Van Alstyne, Dr. Stevenson in PRRS virus work. If you have any other additional comments, I would welcome them.
I just find it interesting that the papers by Lager and Roussel that have actually demonstrated lesions in the fetuses were all fetuses that were taken by C-section.
Yeah, that's a good point.
Autolytic change would obliterate most of the lesions they've described, I believe. So I suspect there probably are lesions. We just can't see them because by the time those pigs are delivered, they've been dead anywhere from a few hours up to probably a week in utero.
Yeah.
And the lesions are quickly analyzed.
And they're also able to isolate virus from the fetuses that they've taken by C-section, where they're nice, fresh fetuses. They've not died in utero. So don't be misled from a diagnostic standpoint by some of those papers. Now this is a group of real mummies. And kind of interesting here is that the mummies, the porcine mummies that we see in this whole litter, are relatively the same size. Well, the way this photograph was taken was to gather up mummies from 2 or 3 different litters and put them all together, because they weren't all delivered like this out of one litter. This is the kind of thing you might see with porcine parvovirus. Another virus that started the whole process, was discussed widely way back in the early 70s, was the enterovirus, the so-called Smitty syndrome, stillbirths, mummified fetuses, infertility, embryonic death, getting the acronym SMEDI. Well, porcine enterovirus infection does in fact cause reproductive loss, and there's 2 or 3 serotypes of that virus that have been associated with it. But most of that work was done prior to the discovery of porcine parvovirus as a cause of reproductive loss. And it's very likely that some of the things they were describing with porcine enterovirus infection may have been either joint infections with parvovirus or may have been parvovirus infections, but they had lumped them in with the porcine enteroviruses. Did I lose the slide in here? Ah, yeah. As I said, there are numerous serotypes. I think at the last count there were 9 or 10 different serotypes of porcine enteroviruses, and about 3 of them have been associated with that. If you do a literature search on porcine enteroviruses and abortion diseases or embryonic deaths and stillbirths, you will find only a handful of papers, and only 2 or 3 of those describe actually controlled infections of pregnant animals. So the literature is very scanty on this particular subject as it pertains to reproductive losses. Abortions are rare with enteroviruses if they even occur. Where I'm not sure whether abortions really occur with enteroviruses. Like other enteroviruses, it is fecal spread. There apparently is a maternal viremia and transplacental infection. And there have been some encephalitis reported in some of these fetuses. Knowing what we do about enteroviruses in the young pig, the occasional sporadic disease we see there with an encephalomyelitis, these lesions of encephalitis in the fetus are probably real. But with porcine parvovirus, you can see the same thing. That's probably all we need to say about enteroviruses, unless anyone has some additional comments on that. We have some diverse expertise in here. If you have any comments, please speak up, because I stand here as the organizer of the information, not necessarily the purveyor of all knowledge. So please add to my knowledge as well as to the collective group. Pseudorabies virus, still fairly common in some parts of the United States, like Iowa. In other parts of the, as it says here, there's an eradication program in the United States, and we seem to be lagging behind a bit and getting rid of it in the state in which I'm living. But on our behalf, we also had more of it to start with, although Indiana had quite a bit, and right through Illinois, Indiana, and Iowa, a fairly high incidence of pseudorabies. Herpes virus, it's a disease of all ages of swine, as most of you are aware. You'll hear about it, I'm sure, again later on when Dr. Janovitz talks about CNS disease. You probably heard a little bit about it in some of the other systems that have been discussed. One of the things that I did want to point out, a couple of different ways that pseudorabies virus can cause abortion. One is just because of the systemic disease that it causes in the dam, and it may not cross the placenta and get to the fetus. So you can't have pseudorabies-induced abortions and not find virus in the fetuses. Or it can cross the placenta. And the other possibility is that it didn't cross the placenta and the sows infect the piglets after birth. So she may be infected with pseudorabies virus near or at term. You don't see the abortion in that particular sow, but CNS disease shows up in her offspring at 2 or 3 days of life, while other sows in that same building are aborting late-term fetuses. While some animals in the gestational building are losing litters there too of different ages. With pseudorabies virus infection in a herd, it moves through the herd fairly rapidly, and sows will generally have reproductive losses somewhere in the neighborhood of about 10 days after they're infected. So if that infection is moving through the herd, you'll see clinical signs at 2 or 3 days after infection, and by 8 to 10 days you'll start seeing reproductive losses. So you may see all kinds of things going on in the same herd. It's been rare in our situations to see abortions only or reproductive loss only with pseudorabies infection. We'll usually see some other signs, some CNS diseases in piglets or some other, some depression, fevers in the sows, very, very common. So all ages of animals infected, and it gives you some clues that pseudorabies may be the cause of the reproductive loss. They describe, at least experimentally and in diagnostic cases, a mild multifocal placentitis. It doesn't really appear to be extensive enough, in my opinion, to interrupt pregnancy. But there are some small little lesions scattered throughout the fetal placenta that might give you a clue that pseudorabies virus is present. More likely, though, you're going to actually find lesions in the fetuses. Some of the fetuses don't have any lesions. If you look carefully enough, though, many of those fetuses aborted due to pseudorabies virus infection, particularly those in the last trimester of pregnancy, will have herpetic lesions, much like you see in IBR abortions in cattle, much like you'd see with equine rhinopneumonitis virus in horses. The multifocal non-suppurative necrosis of the liver, and it's most common in the liver in swine, but you may also find it in the spleen. You may find those lesions in the lung. Finding encephalitis in these fetuses, however, for us is quite rare. Where you'd see encephalitis in neonatal pigs, that is not a real common lesion in aborted fetuses due to pseudorabies virus. So here's a group of fetuses that aborted due to pseudorabies virus. And again, this group of fetuses comes not all from one litter. This was a bucket of fetuses that they brought in the lab. They'd been having widespread reproductive loss with a pseudorabies outbreak. So we've got a couple fetuses over here that had been dead a while in utero. These three look a little fresher. This is a pretty good example of in utero autolysis. This fetus has probably been dead 24 to 48 hours in utero, starting to have a lot of red blood cell breakdown, increased fluid in thoracic abdominal cavities. If we peeled back through the intestinal mass back so you could see the kidney, there'd be fluid around that kidney. Serosanguinous fluid imbibing into subcutaneous tissue. So that's a good example of in utero autolysis. Over here on the right, you can actually see some whitish foci in the liver on that particular fetus. If you turn your imaginators way up or come up a little bit closer, there are a few little white foci in this particular liver. This liver right here, this fetus looks quite fresh. Looks like it has not been dead in utero very long at all. And here on this liver that we could see at a higher power, farther back away from it, multifocal whitish foci. In the spleen, there's also some tiny little white foci, and you may see those then in the lungs. They show up as usually little hemorrhagic foci rather than white. There'll be a little blood with those, so they'll show up as reddish foci. Closer up to those where you can see them just a bit better, the splenic nodules, about 1 millimeter at best. And this is a lung with actually whitey. They show up as whitish foci here because of a reddened background color. And histologically, non-suppurative multifocal areas of necrosis. Can you sharpen that one just a little bit? In the liver. And here's one in the liver where you can actually pick up some of the internuclear inclusions. Finding those internuclear inclusions are not common. Usually there's enough autolysis in these fetuses that the inclusions are hard to demonstrate or are not even there. Can't find them anyway. Buoyans, fixing in buoyans may actually bring these inclusions out better, so you can find them easier, but it's not something that is ordinarily practiced in most laboratories as a routine procedure, just because of handling all that picric acid in the yellow color and getting that out of everything. But buoyans will preserve these herpes virus inclusions better than formalin fixation, and if you're suspecting they're there, you may want to drop some tissue into that particular fixative. And then here, just a higher power of one of those herpes inclusions with the margination of chromatin. I think, what do we got, a minute or so, take a break, and then we'll come back and finish up on, we can take a break now, we'll come back and finish up on the abortion diseases and take a look at some of the congenital. Any questions, or go through some other ones here that are what I would call maybes. The first of those, porcine cytomegalic virus, inclusion body rhinitis virus, herpes virus, is capable experimentally of producing abortions, and in fact we see this virus in a high percentage of herds. If you go through and surveys that have been done, you'll find a high percentage of herds infected with this particular agent. Most often we will see rhinitis with this in the neonatal pig or the post-wean pig. In one case a couple of years ago, we saw what we felt was an abortion problem with cytomegalic virus. The literature, the experimental data would say that these fetuses die 4 to 6 weeks after infection, late term usually, along with some mummies. And the lesions that were seen experimentally and in our field case were the presence of these cytomegalic inclusion and some enlarged cells in both the liver and the lungs. This is an example of the rhinitis, a mucocatarrhal rhinitis, oftentimes fibrinonecrotic in some of these young pigs. So you don't see this lesion in the fetus. This is just the usual presentation, and everyone's probably seen slides of the large basophilic inclusions in the nasal glandular epithelium. That's the usual presentation. In the fetus, though, we saw slightly enlarged livers, and then on histopath saw these more typical herpetic inclusions in liver, and you can see here these are cells that are involved in the endothelial cells or maybe sloughed cells. And the diagnosis was made primarily then on the basis of these lesions, the failure to find pseudorabies virus or other herpes viruses, and concurrent demonstration of inclusion body rhinitis in the herd. So apparently cytomegalic virus is an occasional cause of abortion in swine, probably a rare cause. You have to have a susceptible herd. And diagnosis, unless you find something like this, would be very, very difficult, putting that together with other clinical signs and other lesions in the herd. Very few people in the United States are attempting isolation of this particular virus. Apparently it's a fairly difficult one to grow. And so most of the diagnoses are kind of circumstantial based on finding inclusions and association with disease in the young pigs.
No necrosis, no hepatocellular.
No hepatocellular necrosis, no typical pseudorabies kind of multifocal necrosis. More often what necrosis is just small areas in and around some of these inclusion bodies, endothelial cells in particular, and occasional hepatocyte. Leptospirosis in many parts of the world is still a very important cause of reproductive loss in swine. Vaccination across the Midwest has kept this particular disease in fairly low incidence. Pomona seems to be one of the more common causes of reproductive losses. Bratislava, recently described in the last 5 to 10 years, more associated with stillborns and weak newborns, not with abortions, where with Pomona you get late-term abortions along with the increased stillbirths and weak newborns. This is another one of those infections that usually has no lesions in the fetuses. You can look and look. Occasionally, I think we have, unfortunately I couldn't find this slide, but I saw a case once that had some multifocal necrosis in the liver, and we actually got lepto out of it and demonstrated organisms in it and all that sort of good things. But that was a highly unusual situation for us in our laboratory, to actually find lesions in the fetuses that were recognizable associated with a lepto abortion. We have very few of these where we actually diagnose it. Most of the time the diagnosis is made on the basis of serologically rising titers in the dams associated with a late-term abortion or weak newborn situation. There have been those lesions of multifocal necrosis in the liver described. Mild fibrinous peritonitis and pleuritis have been described, particularly in the newborns. I've never seen it. If you get really lucky and the fetuses are in really good shape, you may be able to, with a Warthin Starry or a Dieterle stain, demonstrate some spirochetal organisms in the renal tubules. This is not a pig fetus. We didn't get this lucky on a pig fetus. This was actually a dog with leptospirosis, so I'll admit that right out front for those that going, boy, I wish I'd have found one like that. But organisms in swine fetuses would be fewer in number than this and rare to find. We have literally looked at thousands, if not tens of thousands, of pig kidneys over the years and have found only 1 or 2 or 3. I think we could probably count them on 2 hands. I wouldn't have to use my toes to tell you how many of those I found. Encephalomyocarditis virus, EMC virus, is it really a pathogen causing abortion in swine, or isn't it? It's a picornavirus, cardiovirus, generally spread from rodents, most likely rats, maybe some mice too. Strain differences are described for pathogenicity. Australia had some problems with this late in the 1980s. Other parts of the world have reported problems as rodent population buildup in association with swine production have occurred. This virus got a lot of attention in the late 80s when PRRS virus was breaking out across the United States. And mystery swine disease for at least a couple years was blamed on by some people EMC virus. That did not, apparently that was not true. It was not due to EMC virus. Experiments have shown that this virus spreads very slowly, if at all, pig to pig. It spreads from the rodent population to the swine. The strains we have in this country don't seem to spread from side-to-side contact of infected pigs, from pig to pig. The isolates, where experimental work has been done, the isolates seem to vary in their fetal pathogenicity from either being non-pathogenic to being mildly pathogenic. The lesions. Lesions in neonatal pigs have been described with EMC virus and depicted here, multifocal, non-suppurative, necrotizing myocarditis. These lesions will then fibrose and calcify and can be seen then grossly in those neonatal pigs with EMC infection. There's 1 or 2 reports that describes that lesion in fetuses. Not common, very rare, but it has been described in fetuses. The other lesion that has been described and is included in the name of that virus is a non-suppurative encephalitis. That lesion is much less common than the myocardial lesion. So the main lesion you're going to see in neonatal pigs is going to be that heart lesion, maybe some non-suppurative encephalitis. A few other viruses you need to consider depending on what part of the world you're in. Hog cholera virus, classical swine fever, is a togavirus, a pestivirus. Very similar story to BVD in cattle in that if you get early infection, you get birth defects such as congenital tremors, cerebellar spinal hypoplasia, hydrocephalus, arthrogryposis. Later on, you can develop immune tolerance, mid-gestation infection, and those pigs may be born as persistent carriers. Last trimester infection with hog cholera virus, and you get abortions and stillbirths. There have been so-called avirulent vaccines used around the world for quite some time. They're still used extensively in Central and South America. Some of these vaccines will produce birth defects, basically interrupting or the growth plates in those. This happens to be a bovine brain since we don't have hog cholera in this country, but just showing some of the lesions of cerebellar hypoplasia, hydrocephalus, and those types of changes. There's also a few papers out that describe BVD virus and blue tongue infection in swine, and apparently occurring most often because of some contamination of vaccines with BVD or blue tongue virus, and they also have a very similar effect as hog cholera vaccine on the fetuses. In utero exposure early produces some birth defects. They've also demonstrated that if they're exposed mid-gestation, you may get postnatal persistent viremias and infections in those animals, and they eventually clear that infection. If they keep the pigs for a couple of years, they can actually clear those infections. African swine fever, again not present in this country, and heaven help us that it doesn't enter the country. But even low virulent strains of African swine fever virus can produce rather devastating abortion outbreaks. This is another case where fetal lesions are usually absent. They claim, those that work with African swine fever virus claim that if you want to make a diagnosis of African swine fever virus abortion in swine, don't look at the fetuses. They don't have any lesions, they don't have any virus for the most part. Look at the dams and the persistent viremia. Brucella suis causes orchitis in a number of species, including cattle. But the Brucella species cause orchitis in bulls, as well as then Brucella suis will cause orchitis in swine. We thought we'd gotten rid of this particular disease. It's uncommon in the United States, but about a year ago there was some Brucella suis cycling through one of the large production units in this country in swine. And so it's probably good to be aware of this particular organism still. Infertility, as in other species, and abortions in sows and gilts. Persistent bacteremia. Brucella suis, one of the things a little different from Brucella abortus is that it primarily is spread at breeding as a venereal infection, where Brucella abortus may spread at the time of abortion from oral exposure. Lesions that are found with brucellosis, brucella suis, have been described much like those brucellosis lesions in cattle. You will usually find a fetal bronchopneumonia, extensive placentitis, and then in the sow, if you look at that uterus, it's fairly common to have what they call miliary uterine brucellosis. Now, since we aren't seen in this country, I really don't have any pictures in swine. This is the extensive lesion that you might see with Brucella abortus in a cattle fetus, which this one happens to be with fibrinous perihepatitis, and you may see fibrinous pleuritis in those fetuses. That's been described in pigs. And the fetal bronchopneumonia with inflammatory cells in the alveoli, and I guess we don't have an airway there. Toxoplasmosis, it's reported in swine. We attempted to infect gilts with toxoplasmosis about 10 or 15 years ago. They all aborted. However, we couldn't find any organisms in the fetus. The sows got pretty sick, and I think they all aborted because of a toxemia and that prostaglandin mechanism rather than because of fetal infection. But inflammatory and degenerative changes have been shown in the CNS, the liver, the lungs, the heart, and most of those reports report it very, very difficult to find the organism in aborted fetuses due to toxoplasmosis. So uncommon. Has anyone here ever diagnosed that as a cause of abortion in swine in this country? How about in other countries? Have you seen it in Europe? So apparently we've seen a few neonatal toxoplasmosis cases in swine, but as far as causing abortions, they've been infrequent. This is just an example, if you were lucky enough to find organisms, what they may look like, and you're all familiar with those. Another what if. Yes, Greg?
Yeah, just a comment. I was talking to somebody that was involved in looking at swine herds as a potential source of animals for research for using swine tissues in biomedical research, human research, and they were looking at various agents in these herds that might be zoonotic. Toxoplasmosis under those conditions is a real
If there is disease, we're not recognizing it. Yeah. Chlamydia is another one of those agents that there are a lot of question marks. Does chlamydia really cause reproductive loss in swine? There are experiments that show that yes, it does. They're chlamydia psittaci isolates. They are different from the bovine and ovine strains of chlamydia psittaci. Chlamydia can be found in many late-term abortions, and while we were looking for the cause of mystery swine disease, chlamydia raised its head because at least one laboratory was finding a fairly high percentage of aborted porcine fetuses to contain chlamydial antigens as detected by a variety of techniques. And in fact, they could grow chlamydia out of these things. Lesions that were described experimentally included choriomeningitis, epicarditis, endocarditis, vasculitis. These are all lesions that we don't usually see at necropsy of these fetuses, and chlamydia are, in my opinion, not a terribly important cause of porcine abortions at this time, at least what we're recognizing here in this country. We're still looking at that issue, still trying to find associations with any outbreaks of otherwise undiagnosed abortions. The other whole list of things, all the bacteria that you can isolate from pig fetuses, generally if that has been the cause of the abortion, you will find some inflammatory changes either in placentas or in fetal tissue such as the fetal lung, as well as isolate the organism in fairly high numbers from fetal stomach contents, lungs, livers, the placental material. Oftentimes these organisms account for only occasional or sporadic abortions. Rarely do they cause any herd outbreak or any problem of that sort. Most of them don't have any particular telltale signs once they're in that fetus. You isolate the organism, you see some inflammatory changes. So the list could go on and on. You look at that list and you'll say there's a lot of those organisms that are rather commensal organisms usually, organisms that don't ordinarily cause any problems. Others that cause problems in the sow, like erysipelathrix, which you could imagine she got fever and sick from that. And then a couple of toxicities that may cause abortions. Moldy corn, zearalenone, may produce swollen vulvas and have been associated with reproductive losses, although it hasn't been well documented that that zearalenone actually caused the reproductive loss. And the other one, nitrates have been reported in swine, not common, pretty rare cause of abortion, but they do and can occur. Carbon monoxide is probably one of the more common toxicities that we see in Iowa in the middle of the winter when they've tightened down all of the ventilation systems in a farrowing barn. They're heating that barn with an open flame type of burner heater, and you will see then some fetuses with what looks like at first when you open these up in utero autolysis, but the fluid takes on a little bit more cherry red color to it, and the history is usually that they delivered entire litters at term and they're all dead. And right down the row you're getting sow after sow delivering dead litters. The sow herself is not sick, doesn't appear to be sick. And you get fetuses with no particular lesions other than that discoloration of the fetal fluids. If you would switch carousels, and I have another handout as we jump into congenital and inherited conditions in swine.
Yes, Doug Rogers is finding several chlamydia in swine, and it's probably not too weird that they isolated some chlamydia from this.
Yeah. Yeah, chlamydia in swine too have been isolated from eyes and from guts, and we'll see an occasional gut lesion with chlamydia in the lesion that we can demonstrate. So it's there, it's being passed from swine to swine, and I would guess that probably it does cause some reproductive loss, but very, very hard to recognize it. I'm going to skip over the general terms that are there on the front, just some background information to you, and go right to teratogenic toxins in swine that are responsible for congenital problems. Because I think one of the things, this is a Picture here of poison hemlock, known to produce cleft palates and contracture-type defects in swine, arthrogryposis, basically when they fed it about day 30 to 75. That's all well and interesting because nicotine will do the same thing, or plants of tobacco, not nicotine itself, but one of the other alkaloids in there will produce defects in those swine. And they found with that experimentally, when it was fed day 30 to 40, they got cleft palates. They fed it 40 to about 55, and they got front limb contractures. Fed it from 50 to 60 days, and they got hind limb defects. And I think one of the things that seems to be really important in this whole thing is that most of these plant toxins that cause fetal defects do it by inhibiting the movement of the fetus during the growth phase of that particular structure. It's very, very critical in the early development stages. And the length of the time that the movement is inhibited, hence the time that that plant is fed, seems to be determine just how severe that particular change is. So it makes a lot of sense, and it's something that you can keep in the back of your mind, not only with plant toxins, but what do viral infections do? Do they use this same mechanism to produce some of the congenital defects that we see, or do they inhibit growth plates and other growing cells, which viruses could do? But with these plant toxins, they found that the cleft palate seems to result when the closure of that palatine cleft is inhibited by the tongue being there. And the tongue usually moves out of its way if the fetus can move its neck and stretch it out. And the tongue will retract and the palate will close. When fed these particular plants at day, 30 to 40, I think it was, they don't move, the tongue stays there, the palate stays open. Feed it a little bit later, they don't move their front limbs, those don't develop correctly, and then fed 50 to 63 days. So cleft palates, arthrogryposis, here's one. I don't know what the palates look like in this particular arthrogrypotic pigs, but you have the clasping front limbs, and then the hind limbs are very, very poorly developed, very, very small, and you can also see then some spinal defects here in those particular animals. In addition to the stage of development in inhibition of the movement of that fetus during its development, there are several other ways that viruses can cause teratogenic effects. One is susceptibility of different cells within the fetus to that particular virus. So if the virus infects rapidly developing cells in the brain, it may cause aplasia or hypoplasia of that particular structure. If it affects growth plates in the bones, it may cause some problems there, et cetera, et cetera. Effect on that cell, does it kill the cell or just inhibit it, would determine then what the effect was teratogenically. And then, of course, what is the function of that cell if it wasn't affected? And later on then, the development of the immune system. Dr. Doan was just telling me over break that some of the experiments that have been done with PRRS virus in Europe, in Germany, it doesn't seem like they get the late-term effects on the fetuses until the immune system seems to develop. So there may be both positive and negative effects, depending on the virus, on the effect that you get after the immune system is developed. It may enhance some changes, it may inhibit others. And we've already talked about hog cholera virus, but the susceptible time during hog cholera infection to the teratogenic effects of that particular virus are early in that pregnancy, about day 13 up to 35. And as you would suspect then, arthrogryposis then can occur from hog cholera infection. There's also effects on the development of the myelin in the brain and in the spinal cord, and you can get lesions of congenital tremors, spinal hypoplasia, and those types of infections. Japanese bee encephalitis virus, another virus we don't have in this country, but if you read the literature coming out of that part of the world, teratogenic effects are very, very common, very similar to those lesions we see reported with hog cholera virus. Other CNS diseases then that may occur in swine, there have been gangliosidosis, GM2 described in Yorkshire pigs. Most of the lysosomal diseases that we've had described in cattle have not been seen in swine. So there's a whole list here of storage diseases that have not, to my knowledge, been described in swine. The same with inherited immunodeficiencies, not common, not reported. Congenital skin abnormalities, have these been discussed already when you talked about skin of swine? Okay. I won't talk too much about epitheliogenesis imperfecta either, other than you will see that occasionally in swine. Seems to be an autosomal recessive, basically characterized by large area of thin hairless epidermis. I don't have a good picture of that one. This one's quite an interesting disease in that there's some things going on right now that may change our impression of dermatosis vegetans. It's seen, several reports have come out of Europe lately on this particular condition. This disease is characterized by dystrophic hooves, seborrhea of adjacent skin, particular ridging of the hoof walls, and then these papules and crusts covering the ventral midline. Invariably, there's a giant cell pneumonia that's present. The giant cell pneumonia starts out in the neonatal pig as an interstitial proliferative pneumonia. Looks a whole lot like a viral process and develops then into a granulomatous giant cell pneumonia, which then later in life regresses. And so it's been described as either a simple recessive or a pair of autosomal recessive genes. But this change in the lungs that seems to be inflammatory in nature is asking us, I think, to re-examine what the defect is here. The defect that results in this whole syndrome, to my knowledge, has not been described. Has anybody read anything more recently than that on dermatosis vegetans? It's something that, have any of you seen that here in the United States recently?
And we kind of had a brief discussion about this because it was presented in the skin section, and apparently it's quite rare. I think we had a general agreement that it's rarely seen. There was a vet path, I think 93 paper that talked about the giant cell pneumonia. They did a lot of work to characterize the origin of that cell. So apparently it's still present in Norway, but we haven't really seen it.
There was a paper, I think, in the British Vet Journal, too, on the origin of that cell. There's been 4 or 5 papers here in the last 3 or 4 years that have looked at that, and you've already discussed that. But Australia, China, and Europe have all had fairly recent papers studying that. I've not seen anything or much from the United States. Dr. Doan, you seen that in you still see that occasionally in some of the breeds over there? Okay. They were describing in landrace and large whites for the most part. Those seem to be the breeds that most frequently be associated with that. I have not seen what I would consider a case of it here in the Midwest. One other disease that is seen that the cause is not known but is suspected may have a hereditary basis is pityriasis rosea. And we do see that cropping up occasionally. The lesions are primarily these flat raised areas with the rim of reddened cells around that. On the ventral abdomen, as the disease progresses, it has a very distinct ridge around the lesion. And that's one that, again, I don't know much about that particular condition, but is suspected of having at least a hereditary basis. Did you discuss that one also in the skin, and any words of wisdom on it? No. Okay. I thought maybe you'd add something to it. Melanosis in swine is seen frequently along with melanomas. Melanosis is fairly common in the Duroc breed and crosses with Durocs. Melanomas are described both in Duroc crosses and in the Sinclair miniature swine that were developed down there at the University of Missouri. The interesting thing about these melanomas is that most of them are regressing, while a few of them are actually progressive melanomas. But most of them, a high percentage of them, will regress. And even some of those tumors that have metastasized will regress. And so it's kind of a different type of melanoma than we see in a lot of the other species. Just a couple of other little sidelights and interesting things. This is pigs with rectal strictures, or with the most common congenital abnormality of internal organs is actually atresia, ani or intestinal atresias. Those are fairly common. We still see a fair number of those. I don't know really what else to say about that. There have been some induced primary megacolons that are of interest in swine, probably as an experimental model. Thalidomide will produce that when given into pregnant sows. Hernia is a very common congenital and hereditary condition in swine, the most common being the inguinal and scrotal hernias. The umbilical ones are also very common, but the exact inheritance of that is not well established. They're very sporadic in nature. And then the other hernias, diaphragmatic and perineal, are fairly rare. We did see a herd with a high incidence of diaphragmatic hernias a few years back and could never establish whether it was actually inherited or whether it was induced by something that they were doing in the management of those swine. But a very high incidence in one herd, and they disappeared. The condition disappeared. Polycystic kidneys, probably the most common renal defect that we see in swine. There's also a model of infantile polycystic disease that's been described by, I believe, Tom Mulaney up at Michigan State and others. That particular model also included some ectatic lesions of the biliary system. And we have also seen sporadically some cases of biliary atresia or intrahepatic biliary cysts occurring in sporadic litters of pigs. Apparently these are recessive because they don't seem to be widespread. It's sort of a gee whiz kind of condition that will occasionally come through our laboratory. Let's see. pseudohermaphrodism or intersexuality defects are fairly common in swine. And the usual presentation is actually the pseudohermaphrodite, where there is an ovotestes with an epididymis on it attached to then what appears to be oviducts and a uterus, and then usually an infantile penis of some sort. So the most common change that we see in swine is that pseudohermaphroditic presentation. A couple of other poisonous plants that we'll run into that will act very much like poison hemlock. This is Jimson weed, or Datura stomata. This, you would have to get a pig awfully hungry to eat that. But if you grind it up and feed it experimentally, it will produce arthrogopotic changes. But Jimson weed in Iowa is usually the last thing standing. They'll eat everything else before they'll touch Jimson weed. Was it from SciPac they described a Jimson weed toxicity in a calf a couple of years ago? What was that? That was pokeweed. Okay, that was pokeweed. Okay.
You gotta get a calf real hungry to eat that.
Yeah, the pokeweed too. Yeah. And then choke cherry will also cause some defects. But again, choke cherry is usually high up in the air where the pigs can't get at it. More often you might see something with cattle. And then a couple of other gee whizzes, interesting kinds of combinations. I wanted to talk just a little bit, this is a thyroid actually on a lamb. We have seen occasional cases of what appear to be a thrombocytopenia purpura in swine, and we're not sure whether they're induced or whether they're inherited. But isoimmune thrombocytopenia purpura has been described in swine where there was some exposure to the antigens, the thrombocyte antigens of the boar that the piglet contains, exposed to the sow, so she was producing colostral antibody to those thrombocytes. This particular case, that did not seem to be the case, and we weren't really convinced exactly whether this was hereditary or whether it was acquired. But we found a lot of hemorrhage in the lymph nodes, a lot of petechia to ecumonic hemorrhages throughout the body, hemorrhages into the GI tract in these very, very young pigs, occurring very shortly after birth. We thought about post-streptococcal infections, that sort of thing, and we're not able to pin down any infectious agent associated with that lesion. Splay legs in pigs is probably the most common condition thought to be inherited, where these little pigs, it's a temporary weakness of those limbs. They can't get those back legs together. Studies have been done. I used to think these were just due to slippery surfaces. Tape their legs together, get them up and going, do something like that, and they will recover and gain some strength in those legs. There have been some studies done on this particular disease where they've studied the nerves, they've studied the muscles, they've studied almost everything, and the major lesion that they find is that the muscles are bigger on normal pigs than they are on these pigs, that the muscle fibers themselves have a larger mean diameter in normal pigs than they do on the splay-legged pigs. Dr. Stevenson, do you have any insight on these splay legs that you could add to that? You see them.
Really, other than just what I had read, I thought it was more common in landrace, and it's polygenic, and with myofibrillar hypoplasia.
Hypoplasia, yeah. It's about all you see, just small muscles and small muscle fibers. And very definitely is inherited, and you can breed away from it. Cranioschisis or failure to close of the medial, I can't come up with the word right now, the midline of the skull, are occasionally reported in swine, and with that then you'll see encephalocele and bulging of the brain material out through that area, meningeal seals, encephaloceles, etc. So that's a fairly common finding, but seems to be very sporadic in nature, does seem to have a inherited recessive look to it.
You ever had that associated with intoxications that you were aware of?
Associated with intoxications, I could not find, I have not seen any cases associated with toxicities and did not find any reference to that. Have you, Dr. Webb, in a couple here?
A guy that came in, he had about 10 of those born one year, and it was right after some spraying accidents, and he was trying to blame everything in town, but I told him being able to go back and prove any of it was going to be too
difficult. Yeah, any other insights on it? Cranioschisis or that particular defect? Rare. We'll see them come in, I would say, 2 or 3 of them a year where something like that will come in as just something they sent along and said, we're getting some of these. What's causing it? And we've talked about arthrogryposis as a developmental change due to toxins and to viruses, but there is also evidence that may be autosomal recessive and an inherited characteristic. So that's another etiology you need to consider when you're looking at arthrogrypotic swine fetuses. And just another example of arthrogryposis, not as severe as that one we saw earlier. This one I wanted to talk about just a little bit. Hyperostosis or porcine cortical hyperostosis. It's a lethal condition in swine. We see this one probably about as commonly as any defect that we get in the diagnostic lab. They're asking us, what is it, and is it inherited? We've got a name for it, and it probably is inherited. But the manifestation of that is you may occasionally get weak pigs, but most of these are going to be born dead or born very, very weak and die shortly thereafter. And the front limbs are markedly enlarged. You can see this one's been cut across here, the bones in the middle, and there's a lot of edema, and also then periosteal growth, trabecular bone growth in that periosteal region. Here's two limbs affected with that. This cross section maybe shows a little bit better. You get subcutaneous edema from about here on out, and all this little white area right in and around the bone is periosteal new bone growth or trabecular growth of that bone. The lesion, there's a couple of different explanations that are found in the literature regarding this. One is that the defect that occurs right here at the epiphyseal plate and where the periosteum anchors right in here at the epiphyseal plate, and that the defect occurs here and allows for a spreading or a separation of the periosteum from the bone so that you get the trabecular growth far away from the actual dense bone growth that's already there. The alternative explanation is that persistent edema somehow allows this growth to occur. These are very remarkable lesions, grossly, and there's some pretty good pictures of them. I didn't get a chance to get a histopath picture of this, but there's a good picture in Jubb and Kennedy of the rather typical trabecular bone growth with this particular condition. Chondrodysplasia are sporadic in swine. There is a dwarf chondrodysplasia. It's not this particular. They don't look like this, but there's a a dwarf chondrodysplasia described in landrace pigs, a lot of chondrodysplasias described in the bovine species, not well documented in swine. And I have, I believe Dr. Thacker talked about porcine stress syndrome yesterday with the musculoskeletal diseases. Just like to add that the defect in this particular condition, did you talk about that, Leon? Seems to be a calcium channel problem with a protein that's called ryanodine, R-Y-A-N-O-D-I-N-E, ryanodine or ryanodine. And that seems to be a protein that is involved in releasing the calcium, hanging on to it or releasing it at the right times, and that is defective in these particular animals. In trying a very definite genetic and hereditary background for this particular condition, I've listed Yorkshire's, Landrace, Poland Chinas, Pietrins, also Durocs, large whites, Hamps. They're seen in a lot of different species, and depending where in the world you're doing surveys, you'll come up with different ratios of how many are affected. They were using, in the past history, was using something like CPKs after exercise or halothane anesthesia to detect the affected animals. And now they're using more molecular techniques, PCRs, trying to look for these proteins or looking for the genetic marker of these proteins to try to determine whether these animals are heterozygotes or affected or carrying this particular trait. This started to appear back in the late 1960s with a real push to increase the rapid growth rate of these animals to develop larger muscle masses, and developed as kind of a side effect of that particular condition. And I think the only other thing I really wanted to say something about here were the congenital tremors situations. We see congenital tremors in the United States usually associated with viral infections. And they've been experimentally reproduced with hog cholera virus. They've been reported with some pseudorabies outbreaks, although I really look at that report and think there may have been something else there too that wasn't found, because we see congenital tremors with very few lesions, some hypomyelinogenesis in the spinal cords, no inflammatory changes in those cords. And way back, well, when your virologist here was doing his graduate work, I think Chuck Conitz here at Purdue looked at congenital tremors pigs. Dr. Gustafson that was here at Purdue had a viral agent growing, had it going in cell culture, and then it disappeared. It quit on him, and he never got that virus really well characterized. Dr. Doan was telling me earlier that in Europe they're talking about circovirus, and circovirus as a possible etiology of this, but they, like us, are having trouble in finding and isolating agents from these particular lesions and from these particular pigs. Follows in most herds a viral infection type of pattern. It will break out in fairly high incidence for a while. The subsequent litters will have a lower and a lower and a lower incidence until the problem subsides. There are, however, genetic congenital tremors in various breeds and various species. So there are some inherited hypomyelinogenesis conditions that will mimic the congenital tremors. The viral-induced ones we'll see as neonatal problems are present at birth. Some of the inherited ones will develop at a little later stage in life. So one thing that might help a little bit in determining whether it's viral or a genetic-based myoclonia is the clinical pattern in the clinical history. You're going to talk about CNS, Evan. You got any insight on shaker pigs, myoclonia congenita beyond that?
Been associated with cerebellar disease and hypomyelination, dysmyelination. Some, hog collar viruses cause it, but not really.
Yeah, and even though there's a report on pseudorabies virus causing it, I personally have some reason to suspect that was probably a congenital tremors virus, whatever that agent is, infected in that same herd that also had some pseudorabies going on.
In fact, the one that Conant was investigating, the ones that had the pseudorabies were protected against it.
They were. Okay, that's interesting.
Because that's what they were doing the research with pseudorabies, and they detected this. They picked up this problem with the tremor. But the pseudorabies virus seemed to protect against it. As you say, it was analyzed.
Now, if you just grab a hold of that projector and move it back and forth a little bit, we'll have a nice picture here of a shaker pig. So, I think the other things that are listed there, if you want to take a look at some of those in the literature or just use that structure to dig into those conditions, none of the rest of the things that are on that list are very common. They're kind of interesting things. There is, you will see right here, we had a case of rickets in swine, and we still see rickets in swine, but there has been a inherited cholecalciferol deficiency described in swine that could be used as a human model.